You're listening to a podcast developed and produced by the Association of Asian Pacific Community Health Organizations, AAPCHO. To learn about AAPCHO, its members, or the principles and values that have guided this organization's work for more than 20 years, please visit www.aapcho.org.
Serving Locally, Leading Nationally is AAPCHO's latest podcast series, observing this year's theme for National Health Center Week. This series celebrates the crucial role of community health centers in providing high-quality healthcare and community development opportunities to many of the most medically underserved populations across the United States. Dr. David Derauf is the Executive Director at Kokua, Kalihi Valley Comprehensive Family Services. In this two-part episode, David speaks with AAPCHO's Communications Assistant, Beverly Quintana, about KKV's community-centered healthcare approach and whether it is in alignment with the current community-centered health home concept. David, as you know, we are currently doing a mini-series on the Community-Centered Health Home, or CCHH, concept. Do you believe the Community Health Center to be a good representation of this model? And if so, why?
I think if we look at the history of community health centers, we see that indeed community health centers began very much out of the same spirit that provides the guiding force for the idea of a community-centered health home. And that spirit is that, as you can see in our name, we are community health centers. We are a health center which is located in a community, typically a community that is underserved by various metrics, oftentimes an indigent population. The medical practice which is located within that community. But I think the emphasis needs to be on the community health part of it. And we, in fact, have a tremendous opportunity, and I believe a responsibility to be centers for community health.
Can you describe what KKV's overall philosophy is with respect to the community-centered health home? Is it in alignment with this concept?
Yeah, I think fundamentally it is in alignment. I think the community-centered health home model, as it's being proposed, it's very early days yet. So ultimately, what that will look like, I think, is open to a great deal of discussion and careful thinking. But the spirit that guides, I think, the community-centered health home model, it shares some commonality with the spirit that undergirds our own health center's orientation. I mean, I think fundamentally, like many current federally qualified health centers, many of us started out, in our case, nearly 40 years ago, as a community-based organization. Medical services began relatively early in our history. But those medical services grew out of a understanding that was one of the priorities that the community had for itself. To this day, our orientation is one that seeks its guidance and its wisdom from the community. And we do that by hiring preferentially from the community and by staying in close and continual contact with as diverse a segment of our community as we possibly can on a daily basis. So, yes, I think our orientation is quite similar to the one described in the current discussion of the community-centered health home.
In addition to what you already touched on, what is KKV doing to affect policy and environmental change efforts in your community?
Going back historically, we established the first center for abused women on the island of Oahu, and we have been a provider of transportation services in a community that is notoriously underserved by public transportation. We have always sought, as I mentioned, to have preferential hiring for individuals within the community and to try to find opportunities for meaningful work for people who live in our community. More recently, some of the more exciting things that are going on here, and just to name a few, as far as I know, we were the first site in the country to have a medical legal partnership for children. So we have partnered with the University of Hawaii, and so the pediatricians are working side by side with lawyers and law students to get at some of the root causes of the underlying conditions for adverse health in the community. We continue to offer and to support microenterprise activities. One of those right now that we're working on is a women's sewing project. We have found a way to, actually through some small grants, to purchase commercial sewing machines and to bring in commercial sewing instructors to work with, primarily in this case, with our population of women from Micronesia who are skilled in seamstresses in their own right, but who have no commercial sewing experience. And We call that, it's part of our family strengthening activities. And many of the women who are in that program are also getting English as a second language instruction simultaneously. And in some cases, they're attending our parenting program as well. A third area we're very excited about is that for the last 6 or 7 years, we've been on 100 acres of land in the back of our community. Land in Hawaiian understanding has a great place in the understanding of health, and we have been intentionally exploring the relationship between healthy people and families and the health of the land in our community while working on 100 acres of state land and in partnership with many, many different organizations and individuals from our community. And presently on the land, we're growing a tremendous amount of organic produce. We're busily engaged in reforestation of the land with native species. We are working with people of all ages to bring back to life the rich traditions and culture and stories of this community, Kalihi Valley. And so one of our jobs in terms of encouraging health in the broadest sense is to help our community to tell that story that they see about this place. Those are just a few of the many different ways that we're working, I think, broadly with the community. I mentioned law, which is, of course entails policy. I mentioned the microenterprise, which is all about economic opportunity. And I mentioned Ho'oluaina, that 100 acres of land, which is all about the environment, but more importantly, the connection between the environment and people.
This podcast was brought to you by AAPCHO. Please join the conversation on our Facebook fan page at facebook.apcho.org and tune in for our next podcast at www.aapcho.org.